All right, John. It's so good to see you today. So my name is Dr. Ali, and I'll be your treating dentist today. So how can I help you?
So I'm here, and I would like to, get implants.
Oh.
And I don't wanna focus on any other, different options. I want implants. So, all my teeth. Can you just put implants there?
Oh, certainly. So you're quite keen to know about the implants and if that's something we can provide, right?
Yeah, my friend got them, and she told me she doesn't have to take anything out of her mouth, and she's quite happy with them. So I would like that too. I have saved enough. I have enough money now. Yeah.
Okay, I'm glad your friend is finding it quite helpful. Yes, no doubt about it. Implants are very good. But do you know what implants are? Do you know about it?
I know that she had to put a screw in somewhere in the mouth, and then they had to put a cap on top.
Yes, exactly. So it's like a small screw that goes into the jawbone. And then on top we place a cap on it. So implants generally have one of the highest success rate, no doubt about it.
Yeah, that's fine. I'll take that.
All right, wonderful. But would it be okay if I ask you some questions so that I can see if that's something we can provide to you and if there's any adjustment we need to make?
Yeah, sure.
All right, great. So you said you really are keen to get this implant. If I may ask, what's the reason? I mean, why implant?
I can't be a dentist. I'm sorry, nothing personal, but I don't like coming and seeing you guys. And I know that once I get it done, I don't have to worry about it. It's just going to be in my mouth, and I just can go ahead and live my life.
Okay.
Yeah.
So it seems like you don't like coming to the dentist very often, right?
Who does?
Well, maybe I could try my luck and change your opinion.
Let's see.
All right. So now that reminds me, you said you don't like coming to the dentist. When was the last time you saw your dentist?
Oh, I don't even remember that. Must be like 2 or 3 years.
Okay, it's been a while. Okay.
Yeah.
So you said you've got quite a few teeth that are missing at the back, right?
Yeah, see, that's where my impression comes from. So I had holes in them, and then I got them filled, and then they got chipped, and then I lost them. So now I am here wanting implants, and I'm assuming that they're going to be expensive.
Well, no wonder you don't like dentists. I can see that. Sorry, now you had this really long history with the teeth having decays and failing. So what was the reason why, why did you end up removing them? Just because the filling didn't work?
They were chipping off constantly, and eventually they broke to a point where they couldn't be. Well, that's what the dentist told me. They couldn't be restored back, so I lost them.
Okay, and have you noticed? You said your teeth were chipping away. Do you feel like the teeth are getting shorter, the remaining teeth?
Yeah, they are.
Okay, does that bother you?
Now that you mentioned, yeah, a bit.
Okay, all right. We'll talk about that as well. Now, in terms of, you had these teeth removed a while ago. Have you got any replacement in that area? Are you using any fake teeth?
No.
Nothing at all?
No.
Okay. And you've been just chewing with your front teeth?
Yeah, pretty much.
Okay, all right. So now, John, sorry if I'm asking you so many questions because
that's okay.
Because it is a surgical procedure. You're as much as I care about your teeth. I also care about your well-being. And I can see you've mentioned you've got a heart valve replacement done.
Yes, I had it 2 years ago, and yeah, everything's good. I'm meant to get my bloods done regularly.
Good.
Don't ask me for the results. I don't know what they are, but
that's okay. I can find with you, doctor. So, are you taking any pills, any medications?
Yeah, 2 a day. It's white in color.
Oh, do you know the name?
No, that I don't know.
Okay. Would it be okay if I check with your doctor to see what medications you're taking?
Yeah, if you can find him. He's in Bali somewhere right now. So, yeah.
Oh, probably I can. It's a great place. I've been planning to go.
Okay.
All right. So, John, now going back to implants, would you like me to explain you about what implants are and what are the things that we would be doing?
I know what implants are, but yeah, you can tell me what you would be doing.
Okay, it's a surgical procedure, and just like your friend had. So we place this screw inside your jawbone, and sometimes it takes about 2 steps. On one step, phase 1, we put those screws, let it there a couple of months, and then after that, we place like a cap on top of it. Now, of course, it's surgical, it's expensive, and also it's done by a specialist. We do have an in-house specialist here as well. But in your case, Joan, there's a couple of things that I'm a bit concerned, which we need to work on. Is number one, you said you haven't seen your dentist for a while, right?
No, I haven't.
So I wanted to ask you, how do you clean your teeth? I mean, the remaining teeth.
I do brush twice a day, and I floss too whenever something gets stuck in them.
Oh, great, that's wonderful. So you said you haven't seen your dentist, you brush, but you occasionally floss every now and then.
Yeah.
It's important for me to check your gum health to see how your gums are. Have you noticed any bleeding?
No, not something significant.
Okay.
Yeah.
That's wonderful.
Maybe if I'm eating Doritos, yeah,
Okay.
but otherwise.
But yeah, this is what I would like to do also, do is do thorough examination, walk my instruments, look at your gum health by measuring the spaces, checking if there's any bleeding, any deposit above and below the gum line. Gum health is very important because otherwise implants will fail because of what we call as perimplantitis.
Oh, okay.
Yeah. Another thing that we need to also see is that you said your teeth were chipping away.
They were.
Yes. Now, you don't have these teeth at the back, John. So what happens is you start using your front teeth. All the forces goes towards the front part of your mouth. And as we start looking at age-related wear.
Oh.
So that could be one reason. And also, it reduces the height of your teeth and your face.
Well, I am 70, so...
Oh, you look so young. I know. So, well, look, that's something we also need to do along with giving you an implant. We need to look into increasing the height of your teeth and your face because it's reduced vertical dimension, which I'm assuming, which I would examine you.
Okay.
And third thing also is you've had these teeth removed a very long time ago. Teeth is what stimulates the bone. And we tend to see lose more bone with the passage of time. And in the top jaw, we have those sinuses, they're hollow spaces that we have. In the lower jaw, you have your nerves. So we might get closer to those, and definitely we don't want to damage those ones. So this is why we would like this procedure to be done with a maxillofacial surgeon.
Oh.
Yes.
So I have to see somebody else.
Oh, don't worry about it. We'll get it organized for you.
Okay.
But most importantly, John, it's your general health. Now, you've had a heart valve replacement done. Now, what happens is when we do any sort of surgical procedure, there are bacteria that are released in your bloodstream. Now, the heart being so close to your mouth, the chances of having infection becomes high, and this is what we call as endocarditis, right?
Yeah, I've heard about it.
Yes, so that's another thing. I need to get in touch with your GP. I need to find out who your cardiologist is, what medications you're taking, because sometimes they might give you some blood thinners like warfarin. Because you said you do regular blood tests as well.
Oh yeah, I have to go in every fortnightly to get it done.
Yes. So if I'm assuming if that's warfarin and if you're doing INR, it's important we get it done 24 hours prior to the procedure so that we ensure you're not bleeding excessively during the procedure. And at the same time, the specialist may want to find out with your cardiologist to give you antibiotic 1 hour prior to ensure we keep your heart safe.
Yeah, they did tell me something about it.
Yes. So that's why what I would do today is do a thorough examination. So what I would like to look at, because you didn't have these teeth for long, I would like to look at your jaw joints. I would like to look at your face, take some photos if you don't mind, look at your face height, and then the remaining teeth, how they are, if there's any decay, how's your gum health, the spaces where we're going to be placing the implants, how much bone we have, and more importantly, we need to take some x-rays as well, like a bigger one called OPG. All right.
Okay, all right.
So it tells us it's just a general survey to see, but the specialist may want to do a different x-ray that we call is a CBCT, which is a 3D scan. It tells us about your bone density and bone quality. So that's very important. And John, sorry, I'm talking so much, but last thing, because I've got another patient waiting. One thing I just wanted to bring up, you said you want to get these implants because you don't want to come to the dentist, right?
That is correct.
Yes. Now, previously things were different, but did you know that now that you have this heart valve, every day when you brush your teeth, there are bacteria released in your bloodstream. Now, those
Oh.
bacteria can go and harm your health, and it can happen endocarditis. So, I would encourage regular dental checks, brushing twice, cleaning in between. I can show you. I can give you some brochures as well.
Okay.
And not only it will add more life to your teeth and your implants, but also I think your well-being is more important for me. What do
Yeah.
you think about it?
Yeah, that seems something doable.
Great, thank you.